Yesterday, Monday, 30th of March, we gave you an update on the developments around Nigeria. Today, we have just begun the first day of restrictions in Lagos and Ogun states and the Federal Capital Territory, Abuja. We are observing developments around the country as we receive reports that are being filed in. The Presidential Task Force has, however, met with security chiefs to smoothen rough edges of implementation within the first day of implementation, and we are working on issuing an appropriate restriction protocol and exemption guidelines which will guide the subsequent days of restrictions. Initial feedback is that there is substantial compliance, but however, there are violations of those restrictions by citizens that we desire to protect. Let me emphasize that the decision to lock down is to prevent community spread, which may be dangerous to manage. It can only be done by Nigerians and for Nigerians. So we would want to use this medium to implore our people and plead with them to please respect and honor restrictions that have been imposed for the good of our people and our nation. I will want to also say that the Presidential Task Force is looking at all prospects of harnessing the resources, personnel, capacity to deploy to ensure that we provide the kind of management that would help our people and give them the basic information that they require to remain safe and healthy. I will now yield the podium to the Honorable Minister of Health and other ministers who would brief you on activities of the Presidential Task Force. By the time we finish harnessing these resources, we will tell you the certain steps and the certain persons that we want to push for volunteers all over the country to support this cause. People who have had experiences in the past and people who are having the current experiences to help ensure that our people are not devoured by this pandemic that is afflicting the entire world. We shall also take your questions and your comments and respond appropriately. Thank you. I now cede the podium to the Honorable Minister of Health, who will begin the session of the briefings. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, Honorable Ministers, the Coordinator of the Presidential Task Force, Directors here present, and DGs. As of today, the 31st of March 2020, we have recorded 135 confirmed cases of COVID-19 in Nigeria, of which 81 are in Lagos, 25 in the Federal Capital Territory, and 8 in Oyo, 4 in Ogun, 2 in Bauchi, 2 in Edo, 2 in Osun, 2 in Enugu, and 1 each in Benue, Ekiti, Kaduna, and Rivers. As mentioned yesterday, the majority are persons from overseas, and others were traced as their close contacts. The high number of cases in Lagos and Abuja, as already said, is directly linked to their function as gateways for international air travel. The incidence of new cases into Nigeria as a result of the closure of the airports and also the land borders will reduce the number of importations, so that we shall be dealing largely with those which have already been brought into the country and are being infected and are being transmitted from person to person. 5 persons have been discharged home after successful treatment. Nigeria has unfortunately recorded 2 fatalities, and both of them had underlying illnesses. Additional strategies are being developed to intensify contact tracing, to support prompt case detection, isolation, and treatment in order to reduce the spread of this infection. The Federal Ministry of Health works closely with the states, and I shall be holding a teleconference with the state commissioners later today, and also with the Presidential Task Force on COVID-19 to review our response activities and update measures to protect the health and well-being of Nigerians. The Nigeria Center for Disease Control has engaged hundreds of ad hoc staff to support call centers, contact tracing, and laboratory work. Happily, many retired staff of NCDC and also of the Ministry of Health have reported for duty. Training is ongoing for medical personnel to support overall preparedness and treatment. We are preparing about 1,000 beds in Abuja to be used immediately as isolation centers if the need arises. The capacity to increase bed space is present. Resources for procurement of required commodities have been provided. More testing sites have been opened in Ibadan and Abakaliki, while existing laboratories are being optimized in their performance. With new additions to the case definition, persons with fever and either cough or difficulty in breathing or shortness of breath in the areas of high COVID-19 prevalence can be tested for the disease. More laboratories will join the network of molecular diagnostic laboratories for COVID-19 in Kaduna, Kano, Maiduguri, Port Harcourt, and Sokoto. As we said yesterday, within the next 2 or 3 weeks, the over 300 gene expert machines that are used for tuberculosis diagnosis will be converted to be used for COVID-19 detection. I want to emphasize that testing is at no cost to anyone in the public, and only results from any of the accredited laboratories, molecular laboratories, are valid and recognized. If you think you fit the case definition of a suspect case, please call NCDC or your state hotline for advice. Preventive measures such as social distancing have proven to be highly effective in many parts of the world and must be adopted as a matter of priority. The same applies to reducing the size of congregations to a minimum. We shall be deploying specialists from the federal government Viral Disease Research and Treatment Center in Irua to Abuja to assist with training and case management. I join those who urge all citizens to accept and practice the protective measures prescribed in good faith, because they are for our common good and the interest of all of us. Importantly, the fight against COVID-19, I say again, is not for the government alone, but for all citizens. With a few simple steps, we can all take responsibility and join the collective effort against this disease. And let me restate what I already stated yesterday. Frequently wash hands with soap under running water for at least 20 seconds. Alternately, use an alcohol-based hand sanitizer. Maintain social distance of at least 5 feet between yourself and others. Self-isolate for 14 days if you have returned from the country from any of the overseas countries in the last 14 days. If during a self-isolation you develop symptoms like cough, fever, shortness of breath, or difficulty in breathing, please call NCDC Connect Center on 0800 97 000010. You can also use the 112 emergency call, national emergency call line, which is now being connected to the NCDC helpline. Please stay at home if you are ill, and above all, stay away from other people. Clean all the frequently touched surfaces with disinfectant at least once a day. Avoid crowds and large gatherings. Cough or sneeze into a tissue or handkerchief with your nose and mouth to cover your nose and your mouth. Dispose of the used ones in the bin and wash your hands. Alternately, if you have no tissue at hand, sneeze into your sleeve at your elbow. Get information only from official sources through the Federal Ministry of Health and the Nigeria Center for Disease Control. In addition to the well-known advisory, I'm again recommending that all families be aware that the elderly among us are particularly vulnerable to COVID-19 disease and should be specially protected from needless contact with persons who could be positive for coronavirus infection, especially those like children who may be positive but show little or no symptoms. The same should be said for all persons with known underlying diseases, such as tuberculosis, HIV, cancer, etc. The NCDC hotline is available round the clock, and it is toll-free, meaning that you can call at no cost to yourself. Various states also have hotlines that can be called for direct state-specific questions on COVID-19. We are working on increasing the call capacity, and the 112 line is open to all people for COVID-19 inquiries. We want to urge all citizens to only use these channels for serious, legitimate reporting and inquiries, and not for joke. Please obey directives issued by federal and state governments and adhere strictly to social distancing measures. Thank you.
Chair, Honorable Ministers, ladies and gentlemen of the press. The Honorable Minister has led in giving exactly what the update is as of today with the epidemiological situation in the country. Let me add 4 points. Firstly, from the pronouncements made from Mr. President, from the workings of the Presidential Task Force led by the SGF, you can see that this challenge is being taken very seriously from the very top. The leadership of our country has taken this as a challenge and is imploring all citizens to work together with all of us so that we can get ahead of the curve. 2, the strategy that we are still implementing is one of containment. It means that we are still at the point where we think we have a window of opportunity to identify all the cases, confirm if they have the disease, bring them into care, confirm all their contacts, follow up each of them, make sure they don't have the disease. For those that do have the disease, bring them into care. This is a very tedious process. We're following up about 5,000 contacts across the country. This is one of the reasons Mr. President asked us what we needed and gave us 2 weeks to free up the roads and enable us to have the space to do this effectively. This comes at some pain to many Nigerians in Lagos, Ogun, and FCT, but it's a necessary precaution and a necessary task, a necessary recommendation in order that the public health workers working particularly in Lagos and Abuja have the opportunity to reach all of these contacts, make sure they are okay, and those that have any symptoms, bring them into care as quickly as possible. Having said that, and as important as Mr. President's speech is, I think now is a time to ask and to do not only what Mr. President has asked you to do, but what Nigerians need to do for themselves. So in carrying out the measures implored by Mr. President, we need to think across the country, what do we need to do for ourselves? Do we have to really meet? Do we want to break these regulations and go out and meet secretly and come out in gatherings? We will be destroying the efforts we are making collectively. So please, Nigerians, I think now is the point not only to do what you've been asked to do by the Presidential Task Force and Mr. President, but to really hold ourselves collectively accountable for carrying out these measures. It's only by doing this and bearing this pain for the next few weeks that we'll have a small chance of containing this outbreak. That's why in collaboration with every communication group in Nigeria, we've launched a campaign on taking responsibility. It's called #TakeResponsibility, because we really need every citizen to be part of this effort, to hold ourselves accountable, to enforce the social distancing. If we are not in contact with each other, that virus cannot circulate among us. So to keep it out, we have to stay apart for a few weeks and try and suppress the further circulation of this outbreak. This is our strategy at the moment, while bringing everyone in contact into care, everyone that becomes a case into care. With these two parallel efforts, focus one are those infected and contacts, and secondly, among everyone else, together we can control the further spread of this outbreak. But we really need everyone to work with us. And that's what we'll keep working on over the next 2 weeks, as we work very hard to use this small window of opportunity to see whether we can bend the curve, get this outbreak under control, and get back to day-to-day life. Thank you.
We shall now take the Minister of Aviation. After him, the Minister of Foreign Affairs will come to the podium. But before we do that, let me just remind Nigerians that we are also broadcasting in Hausa, Igbo, Yoruba, and Fufude on FRCN and the VON. Please tune in.
Gentlemen of media, good afternoon. Thank you very much. We in civil aviation take this campaign extremely very seriously, because we provide platforms for where people interact and continue their journeys from one point to another. For that reason, all airports have been closed to contain this evil, including local airports, arising from the intent of government to continue to keep close tab on this disease and to exterminate it. However, certain flights that are considered to be essential will continue to happen. So Nigerians will continue to see aircraft flying. But those aircraft are qualified. Aircraft in distress, looking for a landing site to save life, is allowed. Aircraft on technical stop, meaning that an aircraft overflying perhaps the airspace of Nigeria, needing to stop to pick fuel somewhere and continue with the journey, perhaps it's traveling to supply some medical equipment to some countries and some communities, that kind of technical stop will be allowed in our airspace and airports. Also, medical evacuation would be allowed, and also cargo will be allowed. These cargo are essential cargoes, not just any cargo. Certain diplomatic flights will be allowed. Certain humanitarian flights those bringing in food items and other humanitarian supplies, medicines, medical equipment, etc., and also security flights. In all of these flights, we have set out protocols to which are well publicized, and we have also tweeted them. Example of them: if there's a flight on ground, all the pilots must remain on board. Assuming there's a cargo coming in from a country into Nigeria, they will operate 2 crews, so they wouldn't have any need to come out to rest and continue their journey. They will remain on board the aircraft, and we will not service them except for fuel. Servicing meaning we will not enter those aircraft and take food, water, or clear their trash. So crew must remain on board. All diplomatic flights requests will going forward pass through Ministry of Foreign Affairs for obvious reasons. We can be copied, so we start the process early, but they must go through Foreign Affairs. Ditto, all security flights must pass through the Office of National Security Advisor. Equally, we can be copied, so we can start to get ready early. Now, some of the essential flights that we have done, and it raised some questions. There's a flight of communication equipment that ought to be in the country to sustain one of the companies providing communications. We allowed that flight to come in, but the pilots remained on board, pilots and engineers remained on board. So also we allowed one NNPC flight to come in because one of our national assets, producing 10% of national revenue, was at the risk of being closed. So we considered it very essential for the 10% of the country's revenue to be allowed. These are examples of essential flights, and they will get approval only from the Minister of Civil Aviation. And if there's any question, we've provided, and I also tweeted my numbers and that of the Permanent Secretary and the Director General of Nigerian Civil Aviation Authority. Be more than happy to answer your questions on WhatsApp or email. Thank you very much indeed.
Ladies and gentlemen of the press, of the media, I thank you for being here to listen to what we have to say in the context of this terrible scourge that we have in the country at the moment. Of course, a lot of other countries have been suffering from this long before ourselves. So it's an opportunity also for us to learn from best practices, from what other countries have done and maybe also should have done. And that's something that we're aggressively doing, keeping in touch with foreign countries and learning from them. And of course also, as the Minister of Aviation has mentioned, the diplomatic corps in Nigeria is a very important constituency of ours. And of course, some of them want to leave, so we are cooperating with them to facilitate this possibility for those who want to leave. But they are an important constituency also because they want to help us at this very difficult time in our country. So we're engaging also with them because there's a lot of assistance that they're also very keen to provide. And that's one of the reasons why we have also provided them with this waiver so they can keep in touch with their various countries and facilitate technical assistance and other assistance for us during this period. And I would really like to thank them because they have been extremely supportive during this period and doing everything possible to help us get through it. We're also engaging foreign countries in providing equipment that we don't have. As you know, we're very short on ventilators. So we've engaged a number of countries, and we're hoping that we might be able to source some. But of course, a lot of the countries that we're looking to for assistance are also facing huge challenges themselves, but nevertheless, they are cooperating with us. There are also other countries that have made it clear that whatever assistance we need, we should let them know, and they will also try to help. And some countries are also offering medical support, doctors available, especially some countries that have already gone through this experience. And that kind of support would be absolutely invaluable for us. And we, of course, saw the situation where some countries also helped us facilitating an emergency airlift that we carried out to bring back some Nigerian resources to come and help in this fight. So, we are fully engaged, working full-time within the presidential task force, and appreciate that there are countries who have some experience that we don't have resources that we don't have, and we're engaging fully with them to try to leverage on all those comparative advantages that they have to assist our people during this very dire times. So thank you very much for your attention.
Thank you very much. We have received the reports with the statement of the Secretary to Government, who is chairman. We have listened to the Minister of Health. We have listened to the Director General of the NCDC, as well as the Ministers of Aviation and Foreign Affairs. In order to make your ability to ask questions very robust, let me make a quick mention of those who are seated around so that you can direct your questions at any of them. We have the National Coordinator, Dr. Aliu. We have the Minister of Humanitarian Affairs, Disaster Management and Social Development. We also have the Minister of Information and Culture. Well, you have seen the Minister of Foreign Affairs, you have seen the Minister of Aviation. We have the Minister of Interior and the Minister of State for Health. So it's now question time. This is how we'll proceed. You come up to the microphone. Please don't touch this microphone for your own safety. We have indications that there will be 8 questions in the first wave, after which the ministers will answer those questions, and then we'll come back for a second wave, which could be your follow-up or the feedback from your various stations. So you have taken your numbers. We start with number 1. Please introduce yourself, your medium, and your question.
Good afternoon, Pastor. My name is Juliana Taiwo. I write for Sun newspapers. First question, why is government, maybe the Secretary to the Government of the Federation or the Minister of Humanitarian Affairs can take this. Why is government talking about palliatives? Why is government not talking about palliatives to Nigerians? Instead, they choose to continue with the school feeding program. 2, maybe the Minister of Foreign Affairs will take this. You just told us that some diplomatic communities are being evacuated, but we have some Nigerians equally stranded abroad that want to be evacuated. For instance, the Diaspora Commission said there are some Nigerian students stranded in Togo and Ghana. What is the federal government doing to bring them back? Thank you.
Number 2.
Good afternoon, sir. My name is Abbas Adebawale Jima from Daily Trust. The first question is for the chairman, the SGF. The civil society organizations and the Nigerian Union of Journalists, they made case to be included in the Presidential Task Force Committee to make the job of the committee better because they can make input and for the journalists to be included. So is there a window for the committee to be broadening in this time that every hands are needed? The second question is for the Honorable Minister of Health. Some governors tested positive. What becomes of their governance after their 14 days isolation, either for positive or for negative? Nigerians were also asking questions. Those who initially tested negative, does it mean they can be infected with the virus? So what comes after? Then Nigerians were also asking questions. They've seen government officials and technical and other experts using the face mask differently, especially those ones that have the double color, either white or green or white or blue, and the check side. So they were asking questions. Maybe we can use this opportunity of telling Nigerians the correct usage of the face mask. Thank you very much.
Good afternoon, Honorable Ministers, DG. My name is Amaka Ode. I'm a reporter with Arise TV. And my question, first of all, will go to the chairman of the task force. And we do know that newspaper vendors, they help, disseminate information. Newspaper vendors. And I'm wondering why they were not included in this exemption. If you can shed more light on that, that would be appreciated, because we're having to send as much information to every sphere of the society. And the next question is for the Minister of Humanitarian Affairs. Well, yesterday, ma'am, you did say that despite the fact that schools are shut, you will still be feeding the school children. And I'm wondering how you intend to do it. So if you can help us, if you're going to go to their homes or you have some sort of program, how to get to the children. Plus, the social register, the last time we got data about the social register, it was in 2017 when the SIP came into play. And of course, unfortunately, since that time, Nigeria has become the poverty capital of the world. So we know more people are poor. And of course, with the lockdown, there's more hardship on these people. So I'm wondering how you're going to carry the poorest of the poor and how you intend to identify those who really need the help. And finally, to the DG of the NCDC, Dr. Chikwe. Well, usually the NCDC give us updated data as to how many confirmed cases we have and also, unfortunately, the fatality. And one key part, which is the hope of all Nigerians, the fact that people are getting discharged. But recently, from that update we get, both on your website and even on Twitter, that has been taken out. So please, why is that so? And we need it restored so at least people know that coronavirus is not a death sentence. Thank you.
Good afternoon to the task force and colleagues. I am Itaire Gwen from the Nigerian Television Authority. Nigerians want the task force to give clarification on whether markets should be part of the lockdown, because some residents in the FCT are already complaining that they cannot access food supplies. And again, those that are engaged in supplying fresh produce like vegetables cannot go to the farms or convey some of these food items from the farms to the market or to the populace, as the case may be. So is there a window for markets to operate during this lockdown, or for public transportation to convey providers of essential items and services. And my second question goes to the Honorable Minister of Humanitarian Affairs. Will Nigerians want you to categorize the vulnerable group that will benefit from the palliatives announced by Mr. President, especially against the backdrop that those mentioned seem to be those already captured in the social investment program? People are asking, what about the internally displaced persons and other categories of vulnerable persons who might not be captured in the social investment program? Thank you very much.
Good afternoon, Honorable Ministers. Rachel from News Agency of Nigeria. My question is for the DG and CDC. Sir, many Nigerians want to understand why Nigeria is only testing for systematic patients. What is the risk of this to Nigeria response, given that asthmatic people can be carriers? Now, two, we all know that the 6 laboratories is meant to be for Lassa fever. And I can remember sometimes in January, you say they cost so much. But you found out that most states request for this same laboratory. Are you not telling them that to maintain it costs millions? Thank you very much.
Number 6.
Good afternoon, ministers. My name is Friday Okerigbe. I'm a reporter with Channels TV. I'm sure either the Minister of Health or the DG NCDC can provide answer to my questions. The first question has to do with what the Minister of Health told us yesterday, that we have over 30,000 test kits in the country. I'd like to know, how many tests are we able to carry out on a daily basis? Then the second question, I'm asking it against the backdrop of a recent report from China that some of the patients that were discharged later tested positive. And we're having patients that are being discharged from the hospitals as we speak. Do we have a tracking mechanism to track their health status after they've been discharged? I'd like to get an answer to that so that I can report it well. And I need clarification also from what the Minister of Health just told us, that we have 5 patients discharged. Yesterday, the Lagos State announced the discharge of 5 patients in Lagos State. And we know that we have patients that have been discharged before Lagos announced 5 yesterday. So, I'd like clarification. When you said 5 patients have been discharged, are you talking of 5 patients that are discharged yesterday, or 5 patients that have been discharged all through? Thank you so much.
Number 7.
Good afternoon, the Presidential Task Force team. My name is Yemi Adebayo from AIT. My question goes to the Minister of Health and the NCDC Director General. Well, there are allegations that a lot of people who actually want to know their COVID-19 status are actually not being attended to or are being turned back. Some of the various testing centers in the country. Yaba perhaps is one of the centers, and Nigerians are wondering why. Is it that there are not enough testing kits on ground, or why are they being turned back? Then secondly, my question has to do with the lockdown order. The SGF, sir, you rightly said that there is a substantial compliance to the order, but there are some also violations. For those who have violated this order, what is the PTF or the federal government is doing, or the security agency perhaps is doing as regards this? Thank you very much.
Good afternoon, Honorable Ministers and the DG, the SGF. My name is Femi Akonde. I'm a reporter with TVC News. And my first question is to the Honorable Minister for Humanitarian Affairs. Since after the President's broadcast, and today is day 1 of lockdown, talking about palliatives, can we get the progress report? In what areas have you actually hit the ground running? And again, about these palliatives, yes, we say to the vulnerable group, but there's this special group, persons with disabilities. I'm aware of Lagos State that this particular group of society are complaining that they don't have that easy access to the food banks and other palliatives put in place by government to ease the hardship during this period of the lockdown. Would you specifically ensure that this group of society are catered for? And again, sir, the DG and CDC, we've seen some of the countries grappling with this scourge come up with estimates. They say maybe in the next 2 weeks we estimate that 500 people, for instance, would be infected. Do we have such estimates, and so that it would help us in planning? And sir, the SGF, sir, these lockdown, of course, it's causing so much hardship for Nigerians. And again, people are complaining. Staying at home is not comfortable. There is no light. The weather is very, very hot. Would you prevail on the Minister of Power to at least talk to electricity companies to make this stay at home at least a little comfortable for Nigerians? Thank you, sir.
Thank you very much. That brings us to the end of the first wave of questions, and we shall be responding in the following order. The Minister of Health, supported closely by the NCDC, the Minister of Humanitarian Affairs, followed by the Minister of Foreign Affairs, then the SGF will come and round it up for the first phase. Minister of Health, sir.
Thank you very much for the questions. I will answer the ones that are related to the health sector and invite the DG of NCDC to answer some others and also add to the ones that I have answered. Now, with the question about what happens to you after 14 days, let me first of all start by saying that this is a new virus. It's called a novel virus, and a lot of its behavior is still being learnt. No one already knows it to the fullest. So many things are being learnt about it from various countries, and researchers are doing as much as possible to understand the behavior. For example, when do the symptoms begin? When are they at their peak? And what happens after the infection? All this that is more or less certain now is that the incubation period is usually within 14 days. I've also seen some reports which say that you can have late symptoms after 14 days, late, up to 20, I have read somewhere. But during that 14 days in isolation, if you tested negative, what it means is that you did not have the virus in you. But it does not mean that you will not have the virus with you again in any other time coming. So if you do a test again in the future, you might again actually test positive, but it doesn't necessarily mean that it came from your previous contact. So it's still a case in study, and it's also believed that there are certain antibodies you develop. How long those antibodies protect you, the humoral protection, is also not very clear yet. Some people have spoken of being able to extract plasma and refine it and use for treatment, but a lot of it is still under investigation. And if the NCDC can shed more light on it, or the WHO representative, will be glad to have that one updated here. Now, the other question about face mask, yes, there are also a lot of mixed messaging. There has been some message, a couple of people who claim that if everybody were using the face mask, then the incidence would drop, because one would not be able to transmit to the other. Each would not be able to transmit to the other. Well, that's still a question. But there are also voices that question the very effectiveness of the mask at all. So again, if you look in the audience here, you see that it's not only here that you see face masks. There are about half or more than half of people there are also wearing masks. So it's a question of which way you lean at the moment, and I believe that with time, more information will come out. One information, generally as it is now, is countered by group of other information that comes out. So those who decide to err on the side of caution wear masks, and others who feel very confident do not. I think that maybe the DG of CDC will add a few things to that. Now, with the question of patients who are discharged, yes, the total number, the figures I gave are cumulative of everything since the beginning. So the 5 are the 5 that have been discharged from the Lagos treating point, where which was announced yesterday. There are some that are due to be discharged. Quite a few are due. But the protocol is that they must test negative 2 times within 24 or 48 hours. And if they have not tested negative 2 times, they will still be held back until they are okay. The treatment usually takes a month if you are actually positive and you have been treated, up to 4 weeks, 5 weeks, 3 weeks, 5 weeks, depending on how your body responds. Now, with the question of people who are being turned back, it is important not to mix the COVID-19 with something like HIV. So HIV, you can go know your status because you may have been infected one way or the other. With the COVID-19, it is different. It's not like HIV that you can catch so easily. The criteria are clear. One is that you must have been in a country which has high burden at any given time. 2 is that you have had a close contact with someone who has come home and probably brought the disease with him from abroad. Now, 3rd category of those community who are getting it in ways that are not quite clear is the one that is very concerning, which raises the specter of community transmission. So people who have never been abroad or haven't been abroad at all in the preceding time, have not been in contact with anyone who has been abroad, and then go to a center and want to test their status, actually making a mistake. They don't understand. Not only do they use up the test kits, which are very scarce, we don't have as many as we would like, but they are also clogging the line in that you don't allow those who are real suspects to be tested because the tests are full of people who really don't even fit the definition. I understand that the fear of coronavirus is so rampant now, is so high that everybody feels it must be coronavirus. If you cough once, if you clear your throat once, you feel it's corona, or if you have feel a little unwell, you think it must be corona. We must not use that as a yardstick. We must rely on objective criteria. Yes, I think those are the questions directed at the Ministry of Health.
Ladies and gentlemen of the press, very good questions. In terms of testing, I think the Minister has answered that very well. There are systematic limitations in the numbers of people that can be tested at the moment. The focus of all our efforts is to improve that and to increase that. At the moment, as at last week, we're testing about 500 per day, or we had the capacity to test 500 per day. By the end of this week, we'll be at 1,000 per day. By next week, we plan to take it to 1,500 a day, just by increasing the number of labs and also increasing the throughput of the labs that we have. So we are managing and improving the supply side. But at the same time, we need to reduce the demand side to those that really need it. So in Lagos, there's a big problem of a lot of anxiety, and everybody wants to get tested. And we need you to help us give this message to people. We have a case definition for COVID-19. Either you have respiratory symptoms plus travel, respiratory symptoms plus contact with a confirmed case, or respiratory symptoms of unknown explanation. So if you have cancer or something like that, we rule that out. These are the 3 groups, i.e. you must have symptoms. And this is an important message, because the more people force themselves into being tested, the less we have the capacity to test those that really need it. These people that really need it will be transmitting into the community, and more people will get infected. So there's a consequence, not just for you as an individual, but for the rest of society. So we need to get to those that we need to get to. And by testing those that don't need it, the worried well, we block the system from those that don't need it, and then the outbreak continues. So there's a price to pay for testing all these asymptomatic individuals. I think the question regarding laboratories, yes, we have the quickest set of laboratories to convert for COVID testing have been the laboratories we've been establishing over the last few years for Lassa. That is where our molecular diagnostic capacity lies. Yes, we haven't done enough over the last few years, and now there's a need to do a lot more very quickly, collectively. This is not just the federal government responsibility, this is a responsibility of all the state governments. Unfortunately, just like power plants, you cannot build a molecular lab overnight. So we are going to work extra hard. The private sector is coming in. Most of the state governments are also funding, as well as ourselves. So together, we're going to increase the number of labs that we're going to bring on stream over the next few months, weeks and months. But the quick solution is not a new lab. The quick solution is how we can increase the throughput in existing labs and repurpose some other existing labs that we have already in the country. There was a question around tracking the discharged patients. Yes, one of the biggest lessons we learned from the Ebola outbreak is the use of technology. And that is one aspect that we have implemented. We've rolled out a system called SORMAS, built on the experience of Ebola. In fact, that system was designed during and shortly after the Ebola outbreak that allows the electronic tracking of every case and every contact of every case in Nigeria. So right now at the EOC, we have the ability to map all the cases, their contacts, know which ones have been discharged, which ones get ill. We know exactly which new case is linked to what contact and which of them don't have any link. So these are all the things that we learned from the Ebola response. And Dr. Faisal, who led that response, can brief you more at any time on the challenges and opportunities during that response and how we have now learned from all of that and implementing a lot of that. We had already rolled this system out in 22 states across the country before this outbreak. So this is work that was going on. We have now accelerated it in the states that we need to. The Honorable Minister has already answered the question on your COVID-19 status. There's no such thing as a status. This is unique to HIV, where you can be infected and there are no symptoms. Therefore, you have to go and test to know whether you're infected. Most other, not all, but most other viral infections, especially the acute ones, will lead to symptoms. And it's those symptoms that will lead you into looking for diagnosis and ultimately care. Now the question about scenarios and estimates, absolutely. We have a number of scenarios that we work with. It's been presented to the Presidential Task Force. Like the Minister always says, we prepare for the worst, but we plan for the best. So we keep working very hard. We know what the scenario is of if we don't do anything. We know what the number of cases, the presumed number of cases if our measures are about 50% effective. We know what to expect if we're 100% effective. It's based on this that we'll measure the effectiveness of the response. But these are not estimates that we necessarily will be sharing in public because they change from day to day as our response proceeds. Finally, on the question relating to mass, the science of it is not completely clear. So some countries have gone one approach, the others have gone another approach. We will continue looking at the evidence with our colleagues in WHO. The guidance at the moment is those that are most at risk, and those that are most at risk of coming into contact with people infected are those that should wear masks. However, there's new emerging evidence, and we'll keep looking at this, and we might change our strategy. The key thing to note is for masks to be effective, at a population basis, we will have to implement the wearing of masks among everyone. So this is really the strategy that we will need to think about. So before we implement a national strategy around mask wearing, we have to be sure that we can provide that or at least enable access to the mask to implement that. So For now, we haven't done so, so we have let everyone to do his own risk assessment and decide on whether they want to wear one or not. And as the evidence comes together, we will make a decision both on the evidence and secondly, on our ability to provide every Nigerian, or at least enable access to these masks to everyone. So I hope I've answered all the questions relating to the response on the health sector side. Thank you.
Honorable Minister of Humanitarian Affairs.
Mr. Chairman, distinguished members of the press, my colleagues. Let me start with the question around the palliatives the government has put in place. We have announced earlier that following Mr. President's directives, we have started deploying these relief materials to the affected states. It is important that we know that these food items, we're going to deploy them from the general grain reserves across the country. So it's going to take at least a minimum of 24 hours or even more before we can start reaching to these 3 locations that these food materials will be. But we have started doing that, and work is still in progress in that regards. On the question around the school feeding program, it's also a directive by His Excellency that we should continue with the school feeding program, and that we should liaise with the state governors on the modalities that we use to take this intervention to these children. We're exploring different options, either by way of food packs or by way of really providing the food. As you may know, the homegrown school feeding program was designed to provide 1 free nutritious meal to pupils of primary 1 to 3 of public schools in their classrooms. And the objective of this program includes boosting school enrollment, attendance and performance, improving nutrition among school, and boosting also the local economy, because by doing this program, we engage the local traders or aggregators that will supply these food raw materials to the cooks for them to cook. So it's a whole cycle of economic activity there. We're currently feeding over 8 million school pupils in 35 states across the country, and 50,000 schools across Nigeria. Whilst seeking our patience and cooperation, we sought out the logistics with the state governors. I've communicated, I've had conversation with the chairman of the Nigerian Governors Forum, Excellency Fayemi, and later in the day we are going to have a web conference together with other governors to sort out the modalities of how we are going to go about that. And we're also discussing on the possibility of the need to extend to even the other states that have not locked down, because students are out of school virtually everywhere in Nigeria. So we're going to extend that. On the issue of the social register, the social register is still there. We have about 2.6 poor and vulnerable households in that register, and so far we have reached out to about 1 million people, about 436 households, 36,000 households across the country. We are looking at areas of rapidly, registering more poor and vulnerable households, but we are also mindful of the fact that this lockdown is going to affect even the urban poor. And this is an area where we're working very seriously to see how we can take this intervention to these urban poor across the country. I mean, especially in the affected areas that have been locked down by the federal government. We have a structure on ground. The community and social engagement structure that we have, we are going to use it. It's a very well-structured structure, and that is, I think, what we are going to use in the distribution of these food items to these people. On the question around the vulnerable groups, yes, our vulnerable groups are categorized into poorest of the poor in the society, people who have been displaced, the elderly, people living with disabilities, and all these people are captured in our interventions. Even in the conditional cash transfer which we give, we have taken care of the people in the IDP camps. We have a program of the ESO, which is the empowerment of the youth amongst the IDPs in the camps. They're still enjoying these interventions from us. We are also reaching out to the households in the camps. We are giving them this conditional cash transfer. And as I mentioned earlier already, we have deployed, we have already finished distributing 2 months in advance of food materials to these IDP camps, especially the ones in the northeastern part of the country. We are now focusing on the ones in the FCT. So there's also another question around the palliatives, which I have answered. Persons with disabilities, we have them in the and just yesterday, the ministry has taken intervention to a community where these persons living with disabilities are. Karamajiji, for instance, we have taken all the hygiene items to them. Very soon we are going to also deploy the food relief to these affected communities. And I want to say the social register is still on. We're still using it, and we're expanding it as it is today. We are looking at capturing about 10.6 million people, and we have already had discussions around that with the UN Social Protection Working Group this morning, and they have agreed that we're going to register at least 1 million more households so that they can benefit from this. The National Social Register provides a pathway to reach at least 2.6. What we have already now on ground in the register is 2.6 million vulnerable households nationwide. With information, sanitization, essentials, and relief supplies are going to be reached. We're going to reach out to these people to take this in to them to cushion the effect of these restrictive measures that are put in place. And let me just give you a brief statistic of this social register. The social register has captured, as I said, 11,045,537 individuals, covering 2,644,995 poor and vulnerable households around the country, with 47,698 communities, 4,946 wards, and then 453 local governments in 35 states of the country. This is a register that we already have. We have all the information in this register, and we are going to use it to carry out these interventions that we're supposed to carry out, especially in the affected states. Thank you very much.
Thank you. Honorable Minister of Foreign Affairs.
Yeah, the question was evacuation of Nigerians in foreign countries. Well, you know, the foreign countries here are relying on their embassies. You know, the embassies are the focal points in every country. So we're in touch with our embassies in all the countries around the world, especially the hardest hit countries. And so if there are those who want to be evacuated, it has to be done within the framework of the embassy. And as at now, we have not had any requests from any of our embassies indicating any significant numbers of Nigerians wishing to be evacuated. And certainly if we receive notification from any of our embassies, then we would certainly start to take that into account and react accordingly. Thank you very much.
Thank you. We'll now take the Secretary to Government of the Federation.
Thank you for the questions. Let me start. Why is government not talking about palliatives? I'm glad that the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development spoke before I came on. But I would urge you to go back to Mr. President's speech. I was just counting as I was seated there. 8 of the paragraphs of that 64-paragraph speech spoke about palliatives. 8, starting from paragraph 49 to 56. He spoke about the interventions of government in trying to soften the effects of the restriction that he was putting in place. And before Mr. President spoke, the governor of Central Bank had rolled out a lot of economic stimulus that would help to keep the economy going and ensure that those that are engaged in trade, in manufacturing, in spite of the fact that the coronavirus attack is not only on our health, but it is also attacking our wealth as a people. Those economic stimulus that were rolled out was all in an attempt to ensure that businesses, in spite of the adverse effect that will come, have some soft cushions. And that was further elaborated in Mr. President's speech when he took paragraph by paragraph, asking for moratorium for the payment of loans that have been taken by smallholder persons, dealing with issues of palliatives. The first paragraph, as a matter of fact, of this 49 spoke about the fact that he realizes the adverse effect of this restriction to satellite communities around these 3 locations, and directed that relief material be given to these communities to soften the effect of the restrictions. So I think as much as possible, palliatives have been rolled out, and they will continue to be rolled out. Yesterday, in addition to that, he directed the establishment of the constitution of the Economic Sustainability Committee to be chaired by the Vice President. And the responsibility of that committee is to look at the entire package and the adverse effects of this particular pandemic on our economy and how our economy will survive post the pandemic. And I believe that that committee will look at some of the issues that would help tremendously in ensuring that our people are not left behind. They are not left in distress, but a little bit of comfort from the side of government, which is the primary responsibility of government, to cater for the welfare and the security of the people, is provided even in this time of their distress. The second question is the inclusion of civil society organizations. If you remember in my opening remarks, I did mention the fact that we have got a pool of reservoir of capacities that are out there that have been used in the past when such times of national emergencies arise. We are going to fall back to that, and I can assure you that I know the civil society organizations are very good in advocacy. Part of the battle plan to deal with this particular pandemic is advocacy. We must get to the rural areas, get our people to be aware of the consequences. I've seen some clips that have kind of saddened my heart. When people say that coronavirus does not exist. And that is the message, the narrative that goes out to our people in the local areas. And they imbibe it because it's coming from responsible leaders of the community. So I believe that the civil societies have got a very major role to play when it comes to the matters of advocacy, getting our people educated on the fact that coronavirus is real. It exists, and it's very, very fast in its spread, and it's very, very vicious. The earlier we come to terms with it, the better for our nation. And all strategies and plans that government is putting in place is for it to safeguard the wealth and the health of our people. And I'm convinced that Nigerians will take heed of that. Somebody asked about the vendors who are the circulators of news. Paragraph 41 of Mr. President's speech covers that, because part of those that are exempt from this restriction are people in the print media, provided they can show that they can't operate from their homes. And I know that the vendors have their associations, because I used to have a friend who is the chairman of the Vendors Association. And they have their marks and their identities, provided they can establish that that is their form of trade. And a vendor cannot operate from his house. He has to be on the street to sell the papers or to distribute the papers. I believe paragraph 41 of Mr. President's speech adequately covers that. There was a question that dealt with compliance, that some states are not complying. I said something yesterday, and it was kind of taken out of context when I said the basis of my presentation was in direct relation to the speech of Mr. President. How many locations has Mr. President prescribed restrictions for? It's Lagos State, Ogun State, and the Federal Capital Territory. That does not in any way imply that state governors cannot prescribe the restrictions in their areas. But Mr. President went further to say that any inconsistencies in policies would be eliminated. So the question of compliance, now that he has even signed the quarantine declaration, the question of compliance will not be in question. And I believe that it is not of our government, it's not in its character to begin to pick people up and throw them behind bars, as is done in other climes. Ours here, our strength, major strength will be from the perspective of persuasion, that as Nigerians we have a responsibility to ourselves to ensure that we do not allow this virus come into our communities and ravage our communities. We are already dealing with several issues of insecurity, of banditry. If we allow this particular pandemic to compound these problems, we as a country would count the losses, and it will be very, very grievous and very difficult to recover from. So ours as a government is by way of persuasion. We do not want to bring the full arms of the law on our people at this very, very time. If need be, it will be done. But the truth about it is that it is more of persuasion, that our people should realize that they have a responsibility as a community, as a people, to ensure that we safeguard ourselves and ensure that we live a country that will be prosperous and a country that will bequeath to the next generation, a country that is strong in its economy, in its systems, and in its structure. The last question had to deal with the issue of the restrictions is causing a lot of discomfort as a result of lack of electricity. And there's an appeal that I should speak to the Minister of Power. I've spoken to him over this a couple of times about the need to ensure that the discos and the GENCOs are doing their jobs. They are also keeping the system running. But we have to also understand that the coronavirus came in big style, in the sense that it did not only affect, unlike other viruses in the past, it has not only come to attack our health as a people, it has also attacked our wealth as a nation. As of today, the cost of crude on the international market is $22 per barrel. Other countries are even discounting. So if you go to sell your product, you might have to sell it at the discounted price. I don't know what the Minister of State Petroleum and the Group Managing Director of NNPC are doing. But as of today, the Brent crude, which is our prime product, is $22 per barrel. And this is directly related to the effect of the coronavirus. So we are dealing with a multifaceted problem, one that is attacking our health as a nation in the same length and breadth is attacking our wealth as a nation. So that would have its own effect on even the supply of gas to the generating stations. If there is not sufficient gas, you do not expect sufficient supply of electricity or power. So our problems are getting compounded. But I know with the resolve and the tenacity and resilience of Nigerians, we will definitely overcome this virus. We've overcome some in the past. This one we will also overcome. Thank you.
Thank you very much. We have received the responses from the various members of the Presidential Task Force. We now have the opportunity for the second wave of questions, follow-up questions, or feedback from your stations. Voice of Nigeria, please.
Good afternoon, the SGF ministers and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question, I think, goes to the SGF. We've been asked to keep social distance in a bid to curb the spread of COVID-19. What is the government doing, or what is the fate of prison inmates, knowing how congested our correctional centers are? All right. All right. Then, secondly, after the lift on the ban, on the restriction in the FCT, I'm very sure that people from other states will be trooping in. So what measures are the government taking to check people coming into places after the restriction has been lifted? And then we also heard that some people are trapped. Some Nigerians are trapped in Togo. They have been kept in isolation centers. They are in a substandard place, and there is a pregnant woman among them. So I don't know what the government is doing about that. Thank you.
Honorable Minister of Interior.
Oh, you have finished the set of questions?
There will be no more questions.
Okay, so you respond. Foreign affairs. I'm fed up Nigerians trapped in Togo.
Well, I must thank you for your question on the custodial centers. Long before now, we have taken measures to ensure a very high level of hygiene at the custodial centers, which to a large extent will minimize any basis for infection or contamination. But with the development of this pandemic, I had a meeting with the Attorney General of the Federation, the Chairman of Presidential Task Force on prison decongestion, and we both agreed that we should propose to the President some measures that will relieve the custodial centers. And I'm happy to announce to Nigerians that the President has approved our recommendations on measures to take to bring some relief to the overburdened, not all of them are overburdened, by the way, to the overburdened custodial centers, which we are going to work upon very, very soon. Let me throw some light on the development in the custodial center in Kaduna. No question is asked, but it's necessary for me to speak on it. The inmates at the condemned section of Kaduna Custodial Center, on the misinformation circulated through the social media on the false amnesty granted to a set of prisoners, began some mutiny, what we should call rightly riots. But I want to assure Nigerians that we have put it under control. We have sent circulars around the custodial centers in Nigeria to tell the managers and the inmates that the information is fake and false, and that we are working on appropriate measure to decongest the custodial centers. That's what I have for you for now. I thank you.
Yes, well, okay. Regarding the Togo situation, we will be in touch with I must confess that this has not come to our attention. So we'll get in touch with our representative in Togo and act as quickly as possible. Thank you.
Before the Secretary to Government takes the floor, we have a question that just came in from one of those watching us from home, the NANS president, and Arise TV will present the question so that you can answer it together.
Well, the question is actually directed at the chairman of this task force as well as the Minister of Humanitarian Affairs. He says, Nigerian students are greatly affected by this pandemic across the globe. Many have been diagnosed to have, even here in Nigeria, and one Nigerian student even died yesterday in the US. Well, he says, what is the task force as well as the Ministry of Humanitarian Affairs doing to address this important strata of the society? That's the students in Nigeria. As you're taking care of the vulnerable, the students are also affected. And he says, owing to the students' population, don't you think that a representative of NAN's leadership will be helpful to the task force and the ministry at this time? Thank you.
The Minister of Humanitarian Affairs will answer first, and it will be rounded off by the chairman of the task force.
I didn't really get that question very clearly. If she can repeat herself while I'm standing here, please.
Well, the student union president, he's saying that a lot of students are affected by the COVID-19. And of course, while you're taking care of the vulnerable and the poor in the society, what are you doing for the students, especially the ones from poor homes?
Well, for now, we are looking at those affected locations as pronounced by His Excellency, Mr. President. So if these students fall within these three affected locations, I'm sure, and they fall within the poor and vulnerable people, these interventions will reach to them. That's what I can say. Thank you.
The chairman of the task force now.
The other question is, why are they not, because they constitute a large segment of the society, why are they not part of it? The more the merrier. I've said this. We are getting to a stage where everybody will become a foot soldier. And I can assure you that because they are not in school now, the coordination of their activities might be limited. I was a student union leader, so I know that when you are not in school, the coordination of the activities is quite limited. But that does not mean that we are not going to involve the young persons or the young adults in this work of advocacy. During the Ebola outbreak and all other outbreaks, I know that the pool of reservoirs, of volunteers that were used came from different stratas of the society. And we are getting to the stage where, in addition to the key health personnel that will be deployed for this work, we will require a large chunk of members of the community that will be called upon to volunteer so that we can collectively fight this particular pandemic that has come to ravage us as a nation. I believe at that point, at the point of recruiting volunteers and people that will be sent out there into the fields, definitely the students' organizations will be considered along with the civil society organizations. I think that's basically the question that referred to me. Togo has been answered. The one to deal with humanitarian has been answered. Thank you, gentlemen.
Thank you. As the chairman of the task force was addressing us, a feedback came in from our ambassador in Togo, and I will invite the Minister of Foreign Affairs to please take the podium to update us.
Yes, thank you very much. I've just been in touch with our ambassador in Togo, and he says that contrary to what you have heard and alleged, that the lady in question is not living in deplorable conditions. She's a lady with her husband. They went for a wedding in Brazil, and on their way back from Brazil, they passed through Addis Ababa to Lomé, Togo, and the lockdown came in. And of course, just as we had in Nigeria, they also had in Togo an isolation period for anybody coming in from a foreign country. And they were placed in the Ibis Hotel, a 4-star hotel in Togo, in separate rooms. And because the period of isolation is still on, our ambassador is not even allowed to go and see them, but is aware, has been to the hotel, and is aware that they are being well looked after in a 4-star hotel. So it's totally wrong to say that there's a Nigerian lady living in deplorable conditions in Togo. Thank you very much.
Thank you very much for the update. This is a very important information. Our inquiries have come in to the aviation sector. First is about cargo arriving in Nigeria. It is mandatory that the packing list of any cargo that is arriving in Nigeria during this period be front-loaded. The list should be forwarded to the Honorable Minister of Aviation, his permanent secretary, or the Director General of the Nigeria Civil Aviation Authority. The second clarification is that aviation staff are part of the essential staff needed to run the day-to-day activities that are required within the aviation sector. So this is part of the information that goes out to the public as well as the security agencies to facilitate their movement. Ladies and gentlemen, and Nigerians watching us from home, we want to thank you for your patience. We want to thank you for staying with us. This is going to be a regular feature during this period and even beyond. And as part of accountability, this task force will be coming before you at 2 p.m. every day to give you updates on what affects you and all of us around here. To our colleagues that are seated here, we want to thank you very much for all the questions that you have been asking. Tomorrow, 2 more languages will be joining the broadcast, that is French and Arabic. We have come to the end of this broadcast. But before I go, let me remind you all, especially at home, the number to call is 0800 97 00 0010 to report any case to the NCDC. I thank you very much.